It's only love and that is all. Why should I feel the way I
Hi all my wonderful TM joiners. I'm Priya Mistry, the TMJ doc. Today's video is going to be about TMJ orthotics. I've gotten a lot of questions from viewers about what my TMJ orthotics look like, what their design is, if they look different from dental night guards, etc. Watch this video until the end for the answers to all those questions and more. Also, feel free to leave a comment below, as your comment may get featured in my new segment called Highlighting a TM Joiner, where I take one of your comments and respond to it. Before getting into it, be sure to check out my social media accounts for lots of tips, trivia, information on TMJD, diagnosis, treatment in general. All of those accounts are linked below. Don't forget to smash that subscribe button so that these videos will be pushed out into the interwebs so more people that are suffering from TMD could potentially get help. For those of you who don't know me, I'm a general dentist with a practice in beautiful Vancouver, Washington. At my practice, we are dedicated to taking care of those with TMJ disorders. So let's get right into it. What do these TMJ orthotics even look like? Before I show them to you, please bear in mind that each TMJ orthotic is custom and specific to the individual wearing it, similar to prescription glasses. If you have poor eyesight, you cannot just wear any glasses and walk around. You have to have a very specific prescription built into a pair of glasses. So that's the same concept with TMJ orthotics. It's all about the position of the jaw. And this specific prescription must be built into the TMJ orthotic. This can be done by a skilled and experienced TMJ dentist. TMJ orthotics cannot be ordered online. I have to see my patients in person to make them. I cannot make them virtually, similar to glasses. You have to go in and do all the proper diagnostic testing to get the proper prescription to get the orthotic built. I use two different designs for my orthotics. I use one more frequently than the other. I use the MORA, M-O-R-A, Mandibular Orthopedic Repositioning Appliance, and the ARA, Anterior Repositioning Appliance. The ARA is also called the Ferrar Appliance. It's named after the dentist who designed it, who came up with the design of it. And I've displayed pictures of both orthotics on the screen here. So take a good look. Let's focus on the MORA. At first glance, the MORA may just look like any night guard that you can get from your dentist or from the drugstore. But looks are deceiving, my friends. The MORA, if made correctly, will have a very specific prescription built into it. This prescription will guide your jaw where to rest, putting it in its optimal position, where the muscles are the most relaxed and the jaw joints are decompressed. The MORA fits on all the lower teeth, and it has bite indexes, small indentations, that guide the upper teeth's cusps where to rest. When the upper teeth's cusps rest in those little indentations, that will help to guide the jaw into a very specific position. This position is what I call the prescription. This prescription is found by using the jaw tracking technology and the software of neuromuscular dentistry. If you're unfamiliar with neuromuscular dentistry, please watch my video, What is Neuromuscular Dentistry? I've linked it above and below. I use that software as well as my knowledge of the TMJ condition. The severity of the condition can make it so that I tweak what the software shows me a little bit to get optimal results. The prescription takes into account the right and left position of the jaw, the forward and backward position of the jaw, and the vertical position of the jaw, the opening. All of these are very important to get correct in order to have good results. This example MORA is marked with black marks all the way around that show where the upper cusps will fit. So again, this fits on the lower arch and it guides the upper cusps where to rest, putting the jaw in a very specific position. So like I said, it may look like a night guard, but there's much more to it. So how is a Mora different from a regular night guard? Well, a regular night guard does not have indentations built into it. I don't know how well you guys can see those, but everywhere it's marked black, there's a dip. And that dip is custom fit to your upper cusps. So a regular night guard does not have these dips in it. What it is it's flat all the way across usually. And usually a night guard fits on the upper arch. Some dentists will make them on the lower arch, some will make them on the upper, but they are usually flat all the way around. So they do not have a specific prescription built into them. They do not guide the jaw to a different position. A night guard does not treat the muscles and the joints. A TMJ orthotic does treat the muscles and the joints. A typical night guard can actually make TMJ issues worse. And I see this a lot at my practice, unfortunately. So as dentists, we're all trying to do good. And in dental school, we actually learned that if somebody has TMJ issues, make them a night guard, they'll feel better. But that's just not the case, unfortunately. So if you do have a night guard and it's making your symptoms worse, I would really try to seek out a skilled and experienced TMJ dentist to help you out. If you're looking for more information on the specific differences between the fabrication and design of a night guard versus a TMJ orthotic, please watch my video, Dental Night Guard versus TMJ Orthotic, linked above and below. The next orthotic I commonly use is an ARA. So let's focus on that one now. ARA, anterior repositioning appliance. So this also has a specific prescription built into it, but what it has in addition to the Mora is it has a little flange that comes down. The ARA fits on the top teeth and has a flange that comes down in the front. It looks like this. So you can see that flange right here. When this fits on the top teeth, that flange makes it so that the bottom teeth come in front of that. So this one really helps to guide and hold the jaw forward more than the Mora does. The ARA also has bite indexes, indentations built all the way around. They are not marked in black on this one like they were for the Mora, but they are there. These indexes guide the lower teeth where to rest, putting the jaw in that very specific position, the prescription position, that's taken into account the right and left, the forward and back, and the vertical position of the jaw. I use the ARA most commonly for my patients who have disc displacement without reduction, also called jaw locked closed. For more information on that, watch my video, Disc Displacement Without Reduction. The ARA comes with a little higher risk of the bite changing throughout treatment than the Mora does. This is because the ARA has that flange that actually really holds the jaw forward when you're wearing it. When the jaw is held forward night after night after night after night, the jaw muscles and joints can kind of start to adapt to that position, leading to a posterior or back teeth open bite. So imagine that. If your jaw is held forward, after a while, if it starts to adapt to that position, the back teeth will develop space between them, that black space that you could see there. That is a posterior open bite. I try to avoid that at all costs, but sometimes it's difficult because the jaw muscles and joints like that position better. So with my patients, I ask them to monitor their bite throughout treatment, and I also do my best to monitor it as well. Lastly, let's talk about the daytime orthotic. This daytime orthotic looks a lot like the Mora. It fits across all the bottom teeth. The difference between the daytime orthotic and the Mora is that the daytime orthotic is significantly thinner in the front. When it's thinner in the front, that gives our tongue more room to speak more clearly. Now, most people sound a little slurpy when they first get the daytime orthotic, and that's okay. There's something in your mouth. Give yourself a little grace is what I always say. Usually it takes about 2 weeks to adapt to having something in your mouth, and the tongue sort of relearns where to go so you're not sounding as slurpy. Many people come in with the daytime orthotic in and a mask on, and I can't even tell that they have it on by the way that they're talking. So it's not so hard to get used to, but there's a bit of a learning curve right at the beginning. The daytime orthotic has indentations for the back teeth, guiding the upper back teeth where to rest, putting the jaw in the same position that the MORA and the ARA put the jaw in. So the same prescription is built into all of these orthotics, giving the jaw a really nice, stable home base. I don't know how well you can see, but the daytime is quite a bit thinner and shorter in the front than the MORA. And I'll hold them side by side here. So you can see here the MORA is built up in the front and has indentations there, while the daytime is not. It's quite a bit smaller. To clarify, the MORA and the ARA are nighttime orthotics, and the daytime orthotic is a daytime orthotic. I hope you found this information helpful. Do keep in mind that orthotic therapy alone will not cure TMJ issues in my experience. I follow up TMJ orthotic therapy with my own sort of soft tissue therapy. We loosen up the muscles in the head, neck, and jaw manually. From outside, we go inside the mouth and loosen up muscles, and I do a very specific osteopathic type of manipulation of the jaw. So for more information on my exact treatment, I do have a video called How I Treat TMJD. Feel free to check that out. Now let's circle back to my segment highlighting a TM joiner. The comment I've chosen to highlight is as follows. Can exercises be performed on the medial pterygoid muscle, or is it unreachable? I've seen you make videos on releasing the lateral pterygoid, but not the medial pterygoid. Thanks. Thank you for your comment. And yes, the medial pterygoid muscle can be massaged. However, it's really, really deep in there. This image shows that it's on the inside border of the jawbone. And so you'd have to dig through a lot of soft tissue to get there. You could hurt yourself. And I just don't feel comfortable sharing how to do that. So if you haven't already, I would recommend that you try to release the lateral pterygoid. I've linked that video above and below. So that's really it, my friends. Again, I'm Dr. Priya Mistry, and I hope you found this video helpful. If so, please feel free to like, subscribe, and share with your family and friends. For those of you who are looking for TMD relief from the comfort of your own home, please feel free to download my free PDF guide called 3 Steps to TMJD Pain Relief. You can find that on my office website if you go to the homepage and scroll all the way down. Again, feel free to leave a comment below or questions below. I try to get back to everybody, but it's just taking me a little longer these days, so please be patient. And of course, my friends, you can never have TMI about TMJ. Thank you.
Why should I feel the way I do? It's only